Today we will be demonstrating suctioning and trach care.
Good morning, Mr. Smith. My name is Angie. I'm going to be doing some suctioning and trach care for you today. Before you do anything with a patient, as you enter the room, you want to perform hand hygiene and provide privacy for your patient. You also want to identify your patient. Mr. Smith, can you tell me your name and date of birth? And that matches with his bracelet. And you also will want to have verified the order. So I'm also going to ask him if he's had this procedure done before. If he's had this procedure done before, then I will just kind of re-explain to him how it's going to go. If he has not had this done before, then I will explain to him and his family, whoever is present, how the procedure goes. One thing though about the procedure is, Mr. Smith, while I'm doing this procedure, it's going to be a little bit difficult for you to communicate with me, so you want to establish a means of communication with your patient. So a good way to do that is, if at any point in this procedure you want me to stop or pause, go ahead and raise your left hand, as opposed to him raising his right hand closest to you and then grabbing you and your equipment while you're doing the procedure. So before you do any procedure, you want to do an assessment. The reason Mr. Smith needs suctioning this morning is because his lungs sound a little crackly. There's some rattles in his bases. I will confirm that by listening. I'm going to listen to his heart, and I'm going to listen to his lungs. And yes, I do indeed hear some crackles in the lower bases. I'm also going to note his respiratory situation. I notice that he's breathing a little labored, and I see that he's on oxygen. It's at pretty high flow oxygen, about 10 liters. But I'm wondering what his oxygen saturation is. So I'm going to go ahead and put a pulse oximeter on his finger that I'm looking at, and it says it's 88%. So with this amount of oxygen that he's getting, the labored breathing and the crackles, it's definitely indicative that he needs to be having some suction. Okay, Mr. Smith, I'm going to go ahead and open my supplies and get my equipment ready, okay? One thing you want to do is make sure you have your suction tubing within reach. And I'm going to go ahead and turn my suction on right now. You want to set the suction to about 80 to 120 millimeters of mercury, or 60 to 120 millimeters of mercury. And you want to have your patient in semi-Fowlers. Okay, so for the tracheostomy care kit, you want to just kind of open it very carefully, making sure that your cover does not go back over your supplies. And then you want to open your suction tubing. You want to take note that when you open this tubing, when you open this kit, make sure that you open it on the right side that you can get to your gloves. If you open it one way, like if you look at it and you see that the gloves are right underneath the sterile drape, then open it that way. So you're going to open that, making sure not to let everything fall back over it. You also want to have a biohazard bag within reach. And again, your suction needs to be at about 80 to 120 millimeters of mercury. Then you're going to open up your new inner cannula and have that ready. And then you're also going to need hemostats and a new trach tie. You also want to get your sterile water solution that you can use to suction and lubricate your tubing. So you want to palm the label, note the expiration date. You want to open the cap and put it place down on the table. And if it's been opened before, you do want to lip it so that you can sterilize the contents. So I have two basins in my kit. So I'm going to utilize both of these. One is for cleaning and one is for suctioning. Being careful not to touch anything on the inside portion there of my kit. So now that I'm done with this part, I'm going to go ahead and just set this behind me, making sure not to turn my back to my sterile field. I just don't want a lot of extra things on my table. Alright, so we are going to now open up my suction tubing, which I did. Some suction tubings come with a drape. If you open your tubing and you see that it has a sterile drape, go ahead and utilize it. Some suction tubings, you open the kit and there is not a drape in there. If there's not a drape in there, that's not a make or break anything. Don't panic about it, just you don't have one to use. Or if you do want to use one, then just have one nearby. I'm just gonna go ahead and pick this up. You want to pick it right up off the table so it doesn't drag on anything, and you want to locate the other side of this. It's shiny side down. So you just kind of want to drape this just over their chest so you have it available. Okay. And you want to make sure that you can get this oxygen moved easily. So now that I've done that, I want to pick up my sterile gloves. Okay, and then I'm going to get my other sterile glove. These are always kind of just in here, folded up kind of in a bundle, so you kind of have to squiggle around and get it situated. So you want to pick it up and then step back so that you don't contaminate anything of your sterile field. Then you want to put your other glove on, and now you are sterile and ready to start the procedure. The last thing you need to pick up out of your sterile suction kit is your actual suction. So you want to pick this up and just get rid of that. You want to keep the tip of this sterile. Yes, my oxygen is at 100%, by the way. You want to keep this tip of this sterile, and you want to twist this up in your right hand. And now with your left hand, you're going to say that you're going to contaminate it because you need to connect your suction catheter to your suction tubing. So I'm going to go ahead and contaminate my left hand. I'm going to pick up my suction tubing, and I'm going to connect the catheter, making sure not to cross-contaminate either of my hands. As you're doing that, you just gently unwind it, and now we're going to check the suction. So you're going to dip this in and make sure that the suction works, making sure that you're keeping your suction catheter above anything, that it's not going to touch anything and be contaminated. So the suction is working, and then the liquid also lubricates it. Okay, Mr. Smith, we're ready to go ahead and get started with your suction. I'm going to remove his oxygen. So you just remove the oxygen a little bit, and what you're going to do is you're going to then, keeping everything above his chest so it's not dragging on him, contaminating everything, you're going to go ahead and insert the cannula until you meet the point of resistance, which is about down to the xiphoid process. When you feel the resistance, it's at that point you'll start to withdraw the catheter. So you want to withdraw the catheter in a twisty motion while you are intermittently suctioning. So twisting, intermittent suction. And you don't want to do this for more than 10 to 15 seconds because you're basically taking the patient's breath away. So they're going to be holding their breath basically for this whole time. So once you pull the catheter out, you want to hold it up like this so none of this gets contaminated. And then you want to give them oxygen again so that you can hyperoxygenate them, let them rest. You want to generally let them rest a minute or two between suction passes. While he's resting and while he's being oxygenated, you can then suction the remains of the secretions out of the tubing, clear that out. 2 minutes have passed. We're going to go ahead and do another suction pass. All right, Mr. Smith, here we go again. We're going to go another time, get all that secretions out of your lungs for you. So you're going to go ahead and insert down until you meet resistance. When you meet resistance, then you're going to want to twist, intermittent suction. It's kind of like patting your head and rubbing your belly at the same time. Okay? That's out. We got a lot of secretions out that time, Mr. Smith, so I bet you're going to be feeling and breathing a lot better now. Reapply his oxygen, hyperoxygenate him, clean the catheter. What you don't want to do is this. You don't want to let your catheter hang down low like this. You always want to make sure that this part is very, very sterile. So you want to clean the suction tubing out, and now we're going to go ahead and disconnect so that we can focus on the trach care part. So you're going to wrap the tubing up. One thing you don't want to do either is suction too many times that you start to get a bloody tinged secretions out, because you don't want to cause any harm to the lung tissue. So I've wrapped my cannula up, I've disconnected it, and remember that it is glove to glove. And I'm going to put that in the biohazard bag. I'm going to go ahead and shut my suction off, making sure not to turn my back to my sterile field. And I'm also now, there's two things I need to do. I need to take out my inner cannula, and I need to take out my sterile dressing here, the old one, and reapply both new ones. So I'm going to go ahead and take the inner cannula out, and I'm going to inspect it, inspect the calf tip, looks good. And then I'm going to go ahead and take this 4x4 dressing off, and I'm going to look at any secretions or any drainage on the dressing area. And then it's skin to skin to remove that. And then I do my hand hygiene, and I'm going to get started again now for step 2, which is trach care. So we've suctioned him out, and now we just need to clean around the area around the stoma in case there's any crusties or just anything that needs cleaned up around there. Also, you would have gotten rid of this too. So I'm done with this. So now I need to get my kit here that I need. I'm not going to use this side of the saline that I used for suction. I want to use the other side here. And again, I can touch the outer edges of this. So, okay, Mr. Smith, we're going to go ahead and I'm going to don some more sterile gloves. So you're going to pick the gloves up, pick it up and step back and apply the glove. Come back up, figure out how you need to get the other glove out, pick it right up. Like I said, the gloves in these containers are a little bit, they're not nicely folded, so you kind of have to figure out where your thumb is. So now you have your sterile gloves on. There is actually a sterile drape in this kit, so I'm going to go ahead and pick that up. Just make sure you pick it up so you don't drag it across the edge. And you just kind of lay that wherever it may be. And then you want to inspect your supplies. So what you have here is just some things that you don't need. We have like some pipe cleaners. We don't need that. There's 2 Q-tips in here that you'll use for cleaning, but we'll actually use like 6 of them. So you want to dip it in the water. Dip it in the water, making sure not to cross over your sterile dressing or anything. So dip it in the water, and then what you want to do is you want to go distal to proximal when you clean. So for example, I want to clean down here. I'm going to start on this side, and I'm going to come across this way. So distal to proximal, and then you don't go back through it. And then you throw this away, just like that. You don't put it in the bag, you just drop it in the bag. And then you're going to get your second Q-tip, and then you're going to go on the top. Distal to proximal, throw it away, get another one, go on the inner cannula side, get that, distal to proximal, throw it away, get a new one, distal to proximal on the top, throw it away, get a new one. It's also important to get underneath in the cannula, like underneath by the stoma, distal to proximal, throw that away, get a new one, and then distal to proximal underneath. And you're also assessing the whole time. So you're assessing what the stoma looks like, assessing what you're cleaning, all of that. And then throw that away. The last thing that you need to do is, before we put the dressing on, This is an easy part to forget because you need to now reach into your inner cannula container and replace the inner cannula. So this is a new inner cannula. Okay, Mr. Smith, I'm just going to insert your new cannula. You see that it's kind of curved, so you kind of put it in sideways like this, and then you turn it and it will just follow the curvature of their body. And you just push it in until it clicks. And then you want to pick up whatever dressings you have left here.
So start setting up my sterile field.
You have a 4x4 dressing if you need it, and then you have a 4x4 split gauze pad. So you want to keep the center of this very sterile. This is the most important part. So you want to just slide this right here beside your patient, right underneath there, and at this point you're not going to be sterile anymore because you're touching the patient now. So you're going to say that you would contaminate your hands now because you need to get the hemostat. And at this point, if you need to remove their pillow, you can, because you kind of need them to be a little bit kind of like that. So what you want to do is just take your hemostats and just kind of tuck this underneath